Hey everyone, and welcome to today's Explainer. We're unpacking something absolutely crucial today. Look, if you're one of the millions of seniors taking a blood pressure pill every single morning, specifically amlodipine, losartan, or lisinopril, you know what just becomes a habit, right? You're on autopilot. But here's the thing. These aren't just harmless daily vitamins. They're potent medications that literally change how your heart, your blood vessels, and your kidneys function every single day.
So let me ask you something, and I want you to really think about it. Do you truly understand what your blood pressure pill is doing inside your body right now? And no, I don't just mean reading the label or that one tiny sentence the pharmacist prints on the bag. I mean, do you understand how it actually works? How it can quietly sort of turn on you under the exact right conditions? Most of us just assume that if we feel okay, the pill is perfectly safe. Well, today we're going to challenge that assumption and we're going to empower you with some real knowledge.
Here's our roadmap for today. First, we'll cover the blood pressure pill illusion. Then we'll look at amlodipine, the swelling mystery, lisinopril, the relentless cough, and losartan, the potassium trap. Finally, we'll wrap up with the sick day danger and smart monitoring, not panic.
Okay, let's jump right into section 1, the blood pressure pill illusion. You see, the name on your bottle isn't just a random label. It represents a specific category that tells you exactly how the drug behaves. We've got 3 common medications here that all lower blood pressure, but honestly, that's where the similarities end. Amlodipine, that's a calcium channel blocker. It relaxes the walls of your blood vessels, specifically the muscle inside your arteries. Then you have lisinopril, an ACE inhibitor. This one blocks a specific enzyme in your body that naturally tightens blood vessels. And losartan is an ARB. It works at a similar step, but blocks the receptors instead of the enzyme. So we're talking about 3 entirely different mechanisms, which means 3 completely different side effect profiles. You just can't treat them as a one-size-fits-all thing.
Moving right along to section 2, amlodipine, the swelling mystery. Let me tell you a quick story to show you why this matters so much. Meet Walter. He's a 74-year-old former engineer, super methodical, took his meds exactly as prescribed. When his doctor added amlodipine, Walter figured no big deal. But just 3 months later, he was secretly panicking. His shoes literally didn't fit anymore. His legs felt incredibly heavy and full by 4 p.m., and he was absolutely terrified his circulation was failing. He was even Googling heart failure. The poor guy was suffering immensely, simply because nobody had explained how his medication actually worked. And this brilliantly illustrates what was going on with Walter. It's a plumbing issue, really. When amlodipine relaxes those small arteries in your legs, it opens them up, letting a lot more blood flow in. But your veins, the pipes responsible for pumping that blood back up to your heart, they don't relax in the same way. So you get this major plumbing imbalance. More blood comes in than goes out. The pressure builds up around your ankles, and fluid gets pushed out into the surrounding tissue. It's not heart failure. It's just a totally predictable physiological response to amlodipine. So what do you do if this happens? First, and this is absolutely crucial, do not just stop taking your medication in silence. That'll make your blood pressure shoot right back up. Also, don't stop drinking water thinking you're retaining fluids. Dehydration on a calcium channel blocker carries its own massive risks. What you do need to do is talk to your doctor. Tell them what's going on. They can adjust the dose, look at alternatives, or suggest simple things like elevating your legs. The key takeaway, never suffer in silence. All right, section 3, lisinopril, the relentless cough. Now, lisinopril has probably the most notorious side effect in the entire ACE inhibitor family. We're talking about a dry, scratchy, relentless tickle in the throat that completely ignores cough drops. Take Evelyn, for example. She's 71, loves gardening. About 4 months into taking lisinopril, she developed this dry cough. It was spring, so naturally she blamed pollen. Fast forward to 11 months in, and she's losing sleep every single night, totally miserable. Her chest x-rays were completely clear. It wasn't until she finally connected the timeline of her meds to the cough that the puzzle was solved. Her doctor switched her to losartan, and boom, 11 months of suffering vanished in just 2 weeks. It's such a tricky side effect because it often delays its appearance, practically tricking you into blaming allergies. But I need to draw a really stark contrast here. Not every throat issue on lisinopril is just a simple nuisance. While that scratchy cough is super annoying, there is another symptom that is a true medical emergency, and that's angioedema. This is sudden swelling of your lips, tongue, face, or throat. If you are taking lisinopril and your throat or lips start to swell up, making it hard to swallow or breathe, do not wait around. Do not just pop a Benadryl to see what happens. Call emergency services immediately. It can close your airway way faster than you'd expect. Let's look at section 4, losartan, the potassium trap. What's truly fascinating and honestly a bit frightening about losartan is that the biggest danger usually comes from patients doing what they firmly believe is super healthy. You see, losartan naturally raises your body's potassium levels, so adding extra potassium on top of that, incredibly dangerous. And the wild part is, it's hiding in places marketed as healthy. People buy low-sodium salt substitutes, not realizing these products literally replace sodium with potassium chloride. Toss in some electrolyte powders, meal replacement shakes, or sports recovery drinks, and suddenly, wow, you are dangerously overloading a system that is already holding on to potassium because of the losartan.
And here's the scariest part. High potassium doesn't always scream for attention. It builds up quietly. The warning signs are subtle, things like unusual muscle weakness, persistent fatigue, maybe some leg cramps, tingling in your hands, or a fluttering, irregular heartbeat. Sometimes you might not feel anything at all, right up until it starts messing with your heart's electrical system. So, if you're using salt substitutes while on losartan or lisinopril, you absolutely must have a conversation with your doctor about monitoring your levels. Okay, Section 5, the sick day danger. Has your doctor ever given you a specific sick day plan? If you're like most folks, the answer is probably no. But think about it. When you get a bad stomach bug, or even if you're just out sweating heavily, your body becomes dehydrated. Your internal fluid volume drops. Suddenly, that exact same dose of losartan or lisinopril, the one that was perfectly calibrated for your well-hydrated body, becomes way too strong. Your blood pressure plummets. Your kidneys, which are already working harder because of the fluid loss, become incredibly vulnerable to strain. An illness completely changes the rules of your body's internal environment. You need a pre-planned strategy from your doctor for when to hold a dose long before you ever get sick.
And speaking of the kidneys, we absolutely have to talk about over-the-counter pain relievers. If your arthritis flares up, you might just grab some ibuprofen or naproxen off the shelf without a second thought. But if you mix those anti-inflammatories with these blood pressure meds, and especially if you're also taking a diuretic, you can cause a severe reduction in blood flow right to your kidneys. Your kidneys don't care if a pill is over-the-counter or a prescription, they only respond to chemistry. Mixing them can cause serious kidney injury, so always consult your doctor for safer alternatives like acetaminophen.
We also need to talk about that brief, wobbly moment of dizziness when you stand up. A lot of seniors just brush it off, right? But just a few seconds of dizziness is enough to cause a fall, and a fall can easily lead to a devastating hip fracture. Honestly, this is just physics at work. Your medication is actively keeping your blood pressure down. So when you jump up quickly, your cardiovascular system needs a moment to compensate, and blood flow to your brain drops for just a second. The fix is so simple but so vital. Just sit on the edge of the bed, hold on to something stable, stand up slowly, give your body a few extra seconds to adjust.
Finally, Section 6, smart monitoring, not panic. Look, checking your blood pressure at home can cause immense and totally unnecessary anxiety. Remember, blood pressure isn't a fixed number. It moves constantly based on how you slept, if you had caffeine, if you're in pain, or honestly, just the anxiety of taking the reading itself. To get real, useful information, you have to monitor properly. Use the same arm, measure at the exact same time of day, rest quietly for 5 minutes before you even press the button. And most importantly, do not take extra doses just because you got one random high reading on a Tuesday morning. Amlodipine, losartan, and lisinopril are not reactive rescue medications. They aren't pain relievers you pop when you get a headache. They work by maintaining a steady, consistent presence in your system over time. I absolutely love this quote from our source material. Let patterns, not panic, guide the conversation. That hits the nail on the head. When you track consistent, methodically measured data over time and you bring that log to your appointment, that gives your doctor the real story. Frantic calls over a single high reading, or skipping doses, or taking extra pills out of fear, that only leads to bad medical decisions. Look for the pattern.
Well, we've covered a ton of ground today, haven't we? From hidden swelling and endless coughs to the potassium traps and sick day dangers. I want to leave you with one final thought to ponder. Are you ready to stop suffering in silence, guessing about what your symptoms mean, and instead start a real, informed conversation with your doctor? Knowledge is your absolute best defense. Thank you so much for joining me in this explainer today. Stay curious and take charge of your health.